So a classic way you might be asked about this is when discussing opioids, and the response would represent analgesic response on our y-axis. And if we were to graph morphine and fentanyl, which are both full agonists, you would see that fentanyl, which is more potent than morphine, sits to the left on this graph, while morphine sits to the right, meaning that you need a higher dose of morphine to achieve the same effect as fentanyl. But both can achieve 100% effect because they're both full agonists. While if we talk about something like buprenorphine, which is a partial agonist, buprenorphine is interesting because it's more potent than morphine, so it sits to the left, but it's not as potent as fentanyl, so it sits to the right of fentanyl, but its efficacy or its Emax does not reach 100%, so it's a partial agonist. Then the other concept that they may throw into a question like this is how would naloxone affect your full agonist? So naloxone is a competitive antagonist, so it will shift the fentanyl and the morphine curve to the right, therefore increasing their ED50s, which decreases their potency. But because it's a competitive antagonist, meaning it shares the same receptor binding site, its effects can be overcome by increasing the dose, so the efficacy is unchanged. They both still reach 100%. But if you have something such as a non-competitive antagonist, then both the potency is decreased, so it shifts to the right, and the efficacy is also decreased because a non-competitive antagonist binds to a different receptor binding site on the same receptor, leading to negative allosteric modulation usually, which can't be overcome with increased dose of the drug. I won't go much further into this, but this is a great question that can be asked as it tests our knowledge on full and partial agonists and pharmacokinetic topics as well.